Hi everyone, welcome to this week's lecture. Thank you all for being accommodating for this new modality. I just wanted to give you time to be able to review this. I understand, we had a fire drill today. Anyway, so this is what we're going to be going over for our fitness lecture. We did have folks come in. So again, Dr. Walters and Alex, they came in to talk about fitness, option, and gerontology respectively. I'm sorry if in the background you can hear my dog playing with her toy. But that being said, let's just go ahead forward and we're going to be going over fitness and health and careers in fitness. So going over chapter 11. So getting back into our professional practice-centered and physical activity sphere. So again, more professional practice, learning about career options that are available to kinesiologists, really focusing on health and fitness. And a core goal to these professions is to really help improve physical functioning, physical health of both individuals and communities. And so this improvement is really based on a very multifaceted view of fitness, including physical health, emotional health, intellectual health, social health, and even spiritual health, in which we're going to see a lot of these careers really do have intersecting domains about how to promote overall health and wellness. And these professions can be practiced in a lot of different settings. They can be more traditionally practiced in like worksite, clinical, commercial, or community spaces. But as we're seeing now, the lines between these settings have blurred. And so it creates a variety of many different career opportunities for kinesiology practitioners. And the reason why we spend an entire unit focusing on careers in health and fitness is really due to this kind of cultural shift we see in how we approach overall health and wellness. And really acknowledging that the rise of non-communicable diseases really kind of allowed for us to recenter our thoughts about health and wellness by acknowledging that these diseases that harm folks in their health have shifted over time. And so to kind of highlight the difference between two different types of disease groups, on the first group we have communicable diseases, which are infectious diseases, things that you can get a cold, a virus, fungal infections. And so these are things that kind of come from outside in and could lead to health ailments. Non-communicable diseases, on the other hand, are non-infectious diseases. And so this can be anything from cancer to cardiovascular strain and issue to just various things. But basically, they're two separate entities. One, communicable, they're things that happen, infectious diseases that happen from an infection. Non-communicable diseases are things that are non-infectious. And to highlight kind of the difference in our communities and how these different diseases impact us, in 1910, 46% of deaths were due to communicable diseases, so infectious diseases. About half the folks who died in this year died from infections, while only 6% of folks died from heart disease, which is a type of non-communicable disease or a non-infectious disease. Compare that to a century later, in which only 3% of deaths were due to an infectious disease compared to 24% to heart disease. And the result of this kind of shift is differences in how we approach the health and fitness industry. The idea that science has evolved, we're able to kind of detect and mitigate and even heal from infectious diseases, but we didn't really see a way to kind of mitigate why these non-communicable diseases were rising. And this is a global problem. This isn't just happening in the United States, but we find that this is happening all over the world, especially in low and middle income nations, in which a lot of these non-communicable diseases can kill upwards of 41 million people each year. And this is a relatively outdated statistic from 2018. But nonetheless, this is a very significant problem across our global community. And so the leading killers in order of these non-communicable diseases are cardiovascular disease, cancer, respiratory disease, and diabetes. And so we start to see these patterns emerging. But in 1996, something really interesting happened. And the Surgeon General's report, for the very first time ever, shifted away from communicable diseases to non-communicable ones. And so the report on health and safety, physical activity and health, differed from previous Surgeon General reports in this way, in which we started to see that non-communicable diseases are plaguing the modern world more so than communicable ones, ways in which we've seen never before. And so because of this, they started to kind of focus a lot more science behind how we can mitigate a lot of these non-communicable diseases. And so a lot of things are out of our control in terms of cancer, genetic predispositions, but there are some things that can be mitigated in order to maybe slow the progression of or eliminate the the disease from developing altogether. And one of those facets is physical activity, in which we start to see that physical activity is no longer merely a recreational endeavor. It is necessary for holistic health and development, which again, as we look back 30 years after this report has been done, that makes a lot of sense in our colloquial understanding of the world. But at the time, it was pretty revolutionary. And so they started to put a lot more initiatives into developing kind of this standardized expectation for physical ability and physical health for folks who are younger, folks who are older, in which young kids and teenagers are recommended to exercise 60 minutes a day. So I don't know if you remember watching TV as a kid, but they had like a 60-day play block, like on Nickelodeon. An hour each day was just this like screen that says, go outside, go play for 60 minutes, then you can come back and watch your shows. And so this is an initiative that was done to really try to get kids to be active physically, understanding that, again, TV is a lot more seductive than going outside and maybe running around or being physically active. But they made that the initiation, or they made that the initiative for kids. And so 60 minutes of physical activity per day, and then muscle and bone strengthening activities 3 times a day. So kind of more like weight oriented or strength building exercises. On the other side, for adults, it's recommended for adults to have 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. And so this is kind of bare minimum. It's not to say that you can't go above, but this is kind of recommended for, okay, this is a good baseline. Again, when we talk about these habilitative strategies, this equipping of different things, baseline is really this kind of 150 or 75 minutes. Additionally, it's also recommended of muscle strengthening exercise 2 days a week. But again, this is the bare minimum. It might be recommended for some folks, some individuals, to exceed these recommended minimum expectations for health. But all this to say, with greater acceptance on a governmental scale, a greater acceptance in the regulatory space, we see this shift and focusing a lot on physical activity, health, fitness, that created a huge opportunity for kinesiology professionals to really kind of create this culture of prioritizing physical health and wellness. And so there's a lot of different settings for folks in the health and fitness space. The first one is these worksite areas, and this can really kind of be more centered around worksite health promotion programs. A lot of companies like Boeing or Amazon or Deloitte is kind of just other private sectors. They have their own designated gym space, exercise spaces for their employees. And this has grown since people started to really prioritize having opportunities for physical health and development. In the 1980s, only about 5% of these private organizations or even public organizations had worksite health promotion programs, but now it's about 50%. And there's a lot of conversations about why to do it or why not to do it. But first, I want to focus on why a lot of companies choose not to have these worksite programs. One, it takes money to have these programs, right? You have to designate space for a gym. You have to have state-of-the-art equipment. You have to have weights. You have to have squat racks. I mean, depending on how thorough you want to be. But there, at the base of it all, you still have to pay for these things, these resources to be accessible. And so companies might not have a lot of, maybe access wealth that they want to promote towards these things. And so for reasons to do it, companies who have these programs, they do better in the stock market because their workers are healthier. So they utilize less sick days, they have less health insurance claims, and they find that they're more loyal to the company because they feel like their company prioritizes them, their health, their longevity. And so all this to say, it is good for the employees and good for the business to have these programs, but this is still a space that we're seeing expansion growing. We also see commercial settings, and they can take 2 different forms, more sales-based or more retention-based, but both of these kind of commercial settings often offer a wide range of health and fitness services and even cater to niche markets. So this can be anything from, utilizing fitness assessments, group trainings, spa services, therapists even, nutritionists can be on staff, and a lot of these niche markets can be like women-only gyms or yoga studios or CrossFit or like Orange Theory. They kind of create this niche community as a part of the health and fitness industry overall. And so to highlight the difference between these 2 different kinds of settings, again, they overall offer a wide variety of opportunities for health and wellness. Sales-based settings typically sell contractual memberships, right? Either year-long, maybe month to month. They really focus on membership sales through more or less kind of manipulative marketing and kind of deceptive sales strategies. They kind of perpetuate the fitness ideals of showing beautiful bodies the idea that, hey, if you come to this gym, you can look like this, and really put up kind of a lot of implicit barriers on folks who might need it more, like people who are older, people with chronic diseases. If they don't see themselves reflected in the ads in these spaces, they're less likely to pursue going to that space to exercise. On the other side of the spectrum, we have more retention-based commercial settings for physical activity and fitness, where these organizations typically sell month to month. It's more of a voluntary kind of process where they can pay whatever they feel like is most pertinent or what's accessible for them in any given time. They generally kind of follow the philosophy that facilities are so good at these spaces that people are going to continue to come back because they want to continue to come back, not because they're contractually obligated to pay for these facilities. And a lot of these organizations usually kind of rely on word of mouth marketing as opposed to very in-your-face tactics like we can see for maybe other more sales-based commercial spaces. And it's because they devote a lot of their income away from marketing and really towards these high-quality equipment, high-quality instruction for maybe more group exercise spaces. And so those are kind of the two end ranges of what these commercial spaces can offer. And I really like that the book brings up Planet Fitness. Planet Fitness, we have one right up the road at the Traffic Circle, but they do a really good job of kind of balancing both sales-based and retention-based marketing strategies, and the idea that they are pretty accessible financially. And so for a lot of sales-based spaces, they are a much more financially feasible option. They often do month-to-month contracts. But although they're a gym space that's kind of for everybody, they really make it a priority to not make it so judgmental. The idea that they have a judgment-free zone philosophy. If any of you have been to a Planet Fitness, they have a honk alarm to kind of discourage people from being like overly grunting or maybe overly demonstrative in their workout, because they want exercise to be a space for everyone. And so these are the two types of commercial spaces. We also have clinical spaces for exercise that includes hospitals, outpatient facilities, sports med, physical therapy clinics, and are usually referred to as MOGs, M-O-Gs, medically oriented gyms. They offer preventative screenings, physical therapy, cardiac rehab for folks who might have experienced trauma to their cardiopulmonary system, disease management, water therapy, but much more oriented to a very vulnerable group of people. The goal is to really reduce the progression of diseases with physical activity. The idea for a lot of these kind of clinical spaces is the idea of exercise as medicine. And again, this can be anyone, not necessarily folks who are particularly vulnerable, but that might be more the priority, right? Getting folks who have experienced an injury, have a disease, but also can be more habilitative too for maybe overweight individuals to really kind of equip them with skill sets to be physically active. We also have community-based settings. And it can take many forms, but the most common form are local branches of nonprofit organizations like the YMCA, city parks and recreation, church organizations for physical fitness, universities, and even apartment complexes that target a specific population, like the folks who live within that apartment complex. And these are typically really serving folks in that local direct community. They offer a variety of programs, really kind of approaching physical fitness as a way for everyone, especially low income or people who can't spend any and all money at all on opportunities for physical fitness. And so this is another way in which community outreach can be very helpful for folks in this space. And then finally, we have more public or health oriented spaces, settings for physical development and health. And a lot of these population-based programs are where health departments, either state agencies or maybe even volunteer organizations like the American Heart Association, the American Lung Association, the American Diabetes Association, really try to increase fitness by reducing non-communicable diseases or both through intervention. So sometimes you could see like the American Heart Association, like every month they have this kind of like fitness challenge, right? It could be like swimming a mile a month, or it can be walking a mile a day, or it could be cycling 3 miles a day, something like that, kind of a challenge to really highlight why and how physical activity can be helpful at mitigating a lot of these non-communicable diseases. And so a lot of these initiatives can be more in this space as well, but really about trying to target all communities and encourage them to be physically active in their own way. ways. And so there's a lot of different roles for health and fitness professionals. And the evolution of these jobs is really in response to this increased public policy, right? We have the 1996 Surgeon General's report, but really we see that as kind of the baseline in which so many additional policies have kind of centered themselves around promoting health and wellness to all communities across the United States. We also see social forces being a driving factor into the adherence or even reluctance in people being physically active. The idea that our community, what our community values, the people around us, these social forces can either encourage or discourage people from being physically active. So if you're within a community, a direct community, a city, a town, a neighborhood that really prioritizes physical activity, people are walking outside, they're walking their dogs, they have community walks or community cycling groups. That can be really helpful for people to feel a part of something, even if it's not some grand scale thing. And then finally, market demands. This is kind of one of those very volatile spaces in our world in which we're still discovering new things about health and fitness. The idea of different types of health and fitness, like HIIT classes, high intensity interval training, or yoga, or strength building, or cardio, the ebb and flow of different ways in which the market kind of decides what people believe is trendy or is in, but overall just trying to get people more physically active. And so most health and fitness professionals now require expertise in multiple areas because these opportunities ebb and flow in different ways. And so people in the health and fitness space need to know a lot of different things. They need to know anatomy, especially if they're working with someone who maybe doesn't understand or for the first time is trying to work out. Where are different things in the body? How are you able to stretch? In terms of physiology, what energy sources are used for activity? Hormone levels, are there certain chemicals that inhibit or encourage activity? In terms of nutrition, what food sources can help my performance? How should I help people have a greater awareness of the food that they eat? And then what factors influence nutrition? Is it the type of sport, the age, the sex of the individual, body type, environment, and programming, right? This is arguably one of the most important things. How many things, or how do I actually prescribe exercise? How many exercises should I do? How many reps? How many sets? How long do I rest in between? And biomechanics as well. The idea that they have to understand how the body works in a physical space and how we can make better choices through biomechanical influence. So this idea of what happens if I change my body position in this certain exercise? Does that help? Does that hurt? How can I change this exercise for someone with an injury? Why does my body move this way? And then for motor control, this idea of how do we learn how to do? How do I get faster? Why can't I do this correctly the first time? How can I help people learn how to do and do things well? In terms of psychology, how can I get people to be motivated? How do I encourage motivation throughout this journey of physical health and fitness? And so all that to say, they have to know a wider variety of stuff because they're kind of one of a lot of people's first steps into their journey of overall health and fitness. And so there's many different professions in this health and fitness space. The very first one are group exercise instructors. And so these are leaders of aerobics classes, outdoor activity classes, aquatics fitness classes, exercise classes for older populations or other more specific populations like older adults, pregnant women, children. And it's important that a lot of these group exercise instructors have a degree in kinesiology or other more health and physical fitness related discipline. It's also important for a lot of group exercise instructors to feel competent and up to date with current trends of physical activity. Because as we talked about before, market trends often drive what's considered popular, what's considered trendy, and that might influence people what types of exercise they should be or want to be involved in. And so it can be anything from Pilates. Pilates is very popular right now, but yoga, Tai Chi, Zumba, just to name a couple of examples. Group exercise instructors must be nationally certified by a nationally recognized organization, ACSM exercise leader, ACE group and fitness instructor, just a couple of examples. And it's really cool, and I'm sure Kelly talked about this today, but in our fitness option, all the classes that our fitness option students take, set them up so that they can sit for these exams right after graduation. And so not only do you get this degree, but you also have the opportunity to be certified, and you can start doing this work very soon after your experience here at Cal State Long Beach. And of course, folks in this space are extremely knowledgeable, they're very dynamic, have excellent leadership skills, and really enjoy working in group settings. But let's say you want to work with maybe a more specific population. And so this is where we get health and fitness specialists. And so you can also think of this group of professionals as health refers to a university instructor as opposed to what a health and fitness specialist is, which are folks who conduct fitness and functional assessments. They design comprehensive individualized exercise programs that incorporate strength, flexibility, and aerobic fitness components, and really try to maximize safety and long-term results. And so this is a particularly enriching profession, because you often work with a lot of special populations in which you're working with older individuals or children, or maybe folks that have developmental disabilities. And so a lot of people really kind of want them to obviously be very versed in kinesiology or other health and fitness related degrees. They often have a lot of certifications because they are working with more vulnerable populations. And so really about this habilitative opportunity to assess where people are at and help them get to where they want to be. You could also be a health and wellness coach, which is a relatively new career option kind of within the last 10, 20 years or so. Minimum, you have to have a bachelor's degree in kinesiology, other health and fitness related discipline. And this is where we get that kind of interdisciplinary, holistic approach to health and wellness. A lot of people in this space help others change their lifestyle and move towards a state of optimal health by focusing not just on physical health, but also behavioral change, stress management, relaxation techniques, time management, smoking cessation, so stop smoking, weight management, as well as exercise prescription. And really the goal of these coaches is to really help guide the client to make their own decisions for their own life. It's a much broader scope than being a personal trainer, because it's not just about the physical part of health and wellness, it's about all these other things. And so they often need additional certifications. They're often kind of the first step into maybe making informed choices about nutrition, about movement, about stress management position or recommendations. And so this is a very multifaceted career option. You could also be a personal trainer, which again, you need at least a bachelor's, but more often than not, if you want to work with high-level athletes or high-level exercisers, a master's degree is recommended in kinesiology or other type of health and fitness profession. You must be certified. There are different certifications based on these national organizations. Please make sure that whatever you do get certified in is legit, that it's actually nationally recognized. Personal trainers are often considered the artists of the health and fitness profession, because not only do they have to understand weight management, they also have to understand stress management, physical fitness, and sport conditioning. And they're very creative and fluid about how they can kind of go about approaching this idea of physical health and wellness. They do work independently. Oftentimes it's usually one-on-one or maybe one-on a group instance at a gym. They can be employed by a facility, and a lot of personal trainers are very business savvy, because a lot of personal trainers kind of work for themselves and they pursue a lot of different goals with their clients. Sometimes clients come in with aesthetic desires, performance objectives, and so they have to be very creative, kind of what this artist mentality is about understanding what their clients want and how to best approach that with a multifaceted idea of physical health and wellness. You could also be a health and fitness director, again, bachelor's degree in kin, and these are kind of the folks that really manage these exercise spaces. They have experience in health and fitness, either maybe as a counselor or personal trainer, but they kind of move up the ladder and really kind of want to guide and direct the vision of these commercial or sales or more retention-based spaces, or even beyond. But really kind of these are the managerial people behind these spaces for physical health and exercise. And so these are folks who manage the facility services and programs. They hire, train, and provide support for staff. They do business planning, establish budgets, renovations, equipment selection, designing and marketing programs, as well as forecast trends for what's going to be the next big thing in this space of health and fitness. And so these are the folks that kind of help guide where things are going in terms of how we as the consumers of these spaces can fully enjoy. You could also have more specialty positions, and again, this was really more focused on what we covered last week, being a clinical exercise physiologist, physical therapists, athletic trainers, coaches, dietitians or nutritionists, working with special populations, a public health educator, and all of these really kind of more orient themselves in more of a maybe clinical space, but they do utilize exercise and fitness to help progress the goals of their clients. And so a lot of these professions, as you know, are licensed professions. They require graduate education or additional certs and qualifications. And then finally, we have public health oriented careers, which kind of gets at our first point actually of how we got to where we are is with public health initiatives, that there's been significant growth in the last 2 decades, really trying to promote kinesiology programs back to their health promotion roots. They focus on the public health aspect of physical activity and really kind of targeting ways in which we can, as a collective, as a society, as a community, really prioritize health and fitness overall. And so a lot of folks in this space maybe could eventually go and become medical practitioners, so like doctors, DOs, MDs, but usually start with getting a master's in public health. Oftentimes they have specializations, and so in this case it would be specialization in physical activity, and there's so many programs for you to be involved in this space. And again, recognizing that public health can come from a lot of different areas in terms of surveillance, monitoring, analysis, health promotion, research, environmental health, recovery, disease prevention. So there's a lot of multifaceted aspects to this space as well that might be more about community efforts and initiatives as opposed to maybe more one-on-one initiatives there. And so, just like we talked about last week, it's incredibly important to continue educating yourself, getting certifications. And in this space specifically, it's extremely necessary for you to differentiate yourself in terms of getting as many certifications as you can, having specialties, niche opportunities, and really allow yourself to grow through professional organizations, because not only do you learn, but you become the best version that you can be in terms of your professional preparedness for your clients. Most employers now, if not all, require certifications just because, again, you need to vet and prove and support that you know what you're talking about, that you're not going to unintentionally or intentionally harm people, that you're really there to help them with their physical fitness and health goals. And so when you are looking at the types of certifications, make sure that they're nationally accredited. Make sure that, you're getting vetted and you're learning a lot, that it should be a challenge, right? These should be challenging, not necessarily hard for the sake of being hard, but you're learning new things, and how you approach that in your work is very important. And so in addition to getting certifications, continued education, feel free to continue leaning on other people for support. Again, Kelly, Dr. Walters came in, Alex came in. We are folks in this space that want to help you. So any of you are interested in the fitness option or want to pursue physical training or personal training, even if you're not in the fitness option, please feel free to reach out to us. We want to help you succeed. This is just another visual for the jobs that we've covered, the evolution of that job, general job duties, as well as the skills and competencies that are necessary to do that job and do it well. So again, this is just up here for you all. And then in terms of trends, where we see ourselves as a collective, as a society going and prioritizing this, it's important to recognize that we are kind of approaching health and fitness very multidimensionally, that it's not just about physical health, but social, emotional, intellectual, and spiritual health. So even if you're not a health and wellness coach, you will still be taking a lot of these tenets into those respective areas still, even if you are more focused on physical health development. It's important to see people where they are as the multifaceted, complex individuals with their goals, their desires, and their abilities to be healthy and holistic. There's going to be a lot of healthcare reform. And again, it kind of is very politicized in terms of how and where that money goes. Are we putting it towards public health initiatives? Are we not? But more often we see that there is this greater push for people to be physically active. And so physical activity is being seen as an integral part of of our nation's health care delivery system. And so we're seeing that this is starting to become so much more relevant and accessible. And a lot of these opportunities for professional growth and getting a job, frankly, are very real. And so again, I lean into that in terms of advice. Obtain a broad education across several multidisciplinary areas, because again, although maybe you're focused on more physical development, there will still be times where you have to take a multifaceted approach. You can seek a combined degree with kin, but just really focus on getting certifications, understanding coursework and theories behind kinesiology, seek experience consulting clients, working with people one-on-one, be able to relate to a diverse population, and of course, obtain internships and work study experiences. Continued education come from many different sources, again, from your experiential learning to learning about theories to learning about the profession itself. And so really lean into that if you are interested in this space. And again, there's so many people that are out there at Cal State Long Beach and beyond that want to help you. And so, and again, this applies to not just folks in the health and fitness space, but really about anyone in kin. We are using physical development, health, and wellness at some capacity in everything that we do. And so really lean into this experiential, theoretical learning of health and fitness and help people in our community, help people around us, our clients and beyond. People need exercise. And so we're serving a social duty by learning about these things. So feel good about that and really lean into that education and experience. And so all that to say, paper 2 is due tonight, so please make sure that you read the rubric, read the opportunities for extra credit as well. Email me if you have any questions. And again, I look forward to reading about your career goals and how you plan to get there. Next week, we are going over physiology and physical activity. So please read chapter 9 as kind of a precursor to what we'll be talking about. Again, paper 2 is due tonight. And then quiz 2, which is about the previous and this week included 3 weeks of class, is going to be due next Friday. Again, let me know if you have any questions. Thank you all for being accommodating to this new modality of learning. And I look forward to seeing you next week. All right, bye.